Hello, bonjour. So we have just received the breast screening guidelines from the independent task force. Let me say at the outset, I'm concerned and I'm disappointed. The guidelines that have been released by the task force simply stated don't conform with the conversations that I've had with experts across the country. Et je vais dire clairement que la situation m'inquiète beaucoup. C'est pas acceptable. C'est absolument essentiel pour chaque femme partout au pays d'obtenir les lignes directrices claires et modernes. Et quand je parle avec des experts partout au pays, il y a une différence majeure avec leur expertise et les recommandations de task force. Now, it's important to state that the task force is independent, and I respect its independence. Decisions with respect to health, particularly public health, must be made at arm's length. They must be rooted in science, and they cannot be political in nature. That having been said, given the very broad divergence between the task force recommendations and what I've heard from other experts, we are taking the following actions. In the first order, I'm extending the consultation period to 60 days at a minimum to make sure that we have time to hear from all experts. Did we get this right? I know it is so important that we do it expeditiously, but we also have to have the right guidelines. And I can tell you to further my comments about being disappointed, there isn't a woman that I've spoken today who's okay with these recommendations. The task force concern that a false positive would cause distress, frankly, I don't buy it. I know that for the women in my life, they'd much rather have a false positive that they get to prove negative than not to be tested. So I really want to encourage women everywhere, notwithstanding what has come out today, to have conversations with their physicians and make sure that they are taking appropriate action in terms of their screening. In the second order, I've asked the Chief Public Health Officer, Theresa Tam, to convene the Chief Medical Officers of Health from across the country, from the provinces and territories, along with key experts, to review the guidelines and to hear their recommendations on what should be done. I also will acknowledge the task force has stated that there are a number of data gaps. Those must be identified and closed. On that basis, I've asked the head of CIHR, the Chief Medical Officer, the Chief Public Health Officer, Theresa Tam, the Canadian Science Officer, officials at Women and Gender Equality, as well as other key partners and experts to identify and close these gaps at pace. I've also asked the Public Health Agency of Canada to accelerate community support, to accelerate the raising of awareness on breast cancer screening, to make sure that we're empowering women, especially women who are at extra risk from particular ethnicities that are known to be more at risk of developing breast cancer. I've also asked Statistics Canada to accelerate the next phase of disaggregated data, especially on race and age, because that appears to be an area of particular weakness. In the last order, I've also asked the Public Health Agency of Canada to accelerate the external review of the task force on preventative healthcare. I'm deeply concerned with the way in which this process unfolded. I think it's essential, as though it's arm's length, for this panel to be reviewed, for its processes and its membership to be reviewed, so that we can make sure that when it comes to preventative health, Canadians are getting the best, most up-to-date, modern advice. Simply stated, the health and well-being, indeed the lives of our mothers, our sisters, and our daughters are dependent on it. As a person who has all three of those, I'm deeply invested in this and ready to take your questions and action.
Can you just be really specific about what part of the guidelines don't sit well with you?
You know, what doesn't sit well with me is the idea that one of the main reasons stated to not lower the age to 40 was that there were going to be false positives. And I acknowledge that as a possibility. And I also acknowledge that if you're a woman and you get a false positive, that's going to be enormously distressing. So I concur with that. But we know that if you don't get screened and you do have cancer and it isn't caught early, that it kills you. And all the women that I've spoken to, both in my professional and personal life, have said they'd rather deal with a false positive than miss the opportunity to get that cancer diagnosed early. And when it comes to breast cancer, we've made such incredible advances in science to be able to save lives and stop terrible outcomes by catching it early. And so that's why screening is so essential. And I hope that people are, as they're hearing this debate, and it's an important debate and it has to be rooted in science, that women across the country really hear loudly that getting screened is important. And that maybe, yes, there's a small chance you get a false positive and that's be scary, but it's a lot less scary than missing a cancer early and saving your life.
Can I just ask, are we to take this that the Canadians should just disregard these guidelines altogether? And when I heard your comment about potentially looking at the membership of this task force, our understanding of the voting members of this task force, there was no oncologists, no experts. Do you want to see that changed?
Yeah, there was already, there's a sort of a regular review process. To take your second question first, there's a regular review process. I'm accelerating that. I think that we need to take a really hard look at the way this task force is representative of medicine and science writ large, and whether or not it's the right composition. It plays an absolutely critical role in providing scientifically rooted health guidance, particularly in the area of prevention. I would say that what women should do is have conversations with their doctors, and they should feel empowered to be able to ask if they have concern for a screening. There are, this is one of the reasons why I'm concerned with this decision, because I want Canada to have the most up-to-date, modern, science-based guidance possible. It seems to me, based on other experts I'm talking to, that we're missing the mark. I want to close that as quickly as possible so that we can give science, fact-based information to women. But right now, there's some ambiguity around that, right? If you're under 50 years old, and I want to end that as quickly as possible.
Minister, can I get your response to the Ontario Association of Radiologists? They call this task force archaic. It was late in delivering its points, did not make evidence-based recommendations, and that it should immediately be disbanded by the federal government. What's your response to that?
Well, I share their concern and disappointment, and that I have not been impressed by this process. But I also recognize that it is an independent process and we must treat it with rigor. And that's why I want to make sure that we accelerate the external expert review. I think we have to be very careful. It's very tough because sometimes you're in a situation like this and I'm extremely disappointed and frankly angry. But we have to root this not in my feelings as health. It's not up to me, Mark Holland, and what I feel. Make sure that we have real rigor, because you may have some future date where a health minister isn't rooted in science and evidence, and would use the precedent of me acting without rigor and caution to do something really injurious to public health. So, accelerating that expert panel, making sure that we're listening to experts and we're rooting these decisions in science and proving that we are, and using restraint. I have to use that restraint in order to protect future processes.
Should Canadians disregard the advice of this task force?
I think Canadians should have conversations with their doctors about individual health advice. What I would say, because I have a daughter, to be really direct. And if my daughter was in a circumstance where she was worried about the state of her health, and my daughter is in her 20s, I would say that, if she has a concern or really feels that, there's a reason that she should be screened, she should be talking to her doctor, she should be advocating for that and having that conversation. The guidelines are extremely important. One of the reasons we have to review this panel is that these recommendations have to be up to date and changed as quickly as science is moving. And right now, that doesn't appear to be the case.
Canadians don't have a family doctor to talk to. It seems that you understand what the correct advice is from other experts you've spoken to. Is it fair to ask women to have to advocate for themselves to have this kind of preventative testing done, rather than just suggesting, as the federal government, that we follow the advice of the experts that we've heard from?
No, it's not fair. I just simply stated it's not fair. I'm upset that I'm in this circumstance. But as I said, we have to use our processes to get out of it. One of the challenges of being in an evidence-based, science-rooted system is that we have to move more slowly and methodically than we would sometimes like. But I've thought about the alternative. I've thought about, well, what happens if I just, change this? And I'm so concerned about what precedent that would establish, because there are many circumstances that we don't envision today where a future health minister may use the action taken earnestly now by me to do something much more nefarious in the future. So, part of it is I want to get to that situation where we have guidelines that we have consensus around in the scientific community and with experts. I want us to get to that as fast as possible, but we have to do it prudently, and we have to get it right. And that's why I've extended that consultation period. I've extended it to 60 days. I want to see us do it fast, but I think we have to demonstrate that it's rooted in science and evidence.
Can we get an update on the... There is evidence to suggest that Black Canadians actually do get breast cancer a little bit earlier and that they fall through the cracks of screening. Is that being taken into consideration at all when you're talking about the age that they should start getting tested?
Yeah, so one of the things you would have heard me say is I've asked Statistics Canada to accelerate the way in which we collect data and have data available for racialized communities, because you're absolutely right. It appears that certain ethnic communities are disproportionately affected, and that we have data gaps there that are unacceptable. And so I've also asked the Public Health Agency to accelerate the programs at a community level to raise awareness, specifically with communities that are at risk. So there's a lot of things that we can do right now on the ground at a community level with the Public Health Agency to raise awareness and to reach out to women, and particularly those who are disproportionately at risk, while we're also working on these guidelines.
On a different topic,
Here and then there.
Canadian researchers who have been testing for H5N1 bird flu in dairy milk, they say ongoing testing should be a priority, but the Canadian Food Inspection Agency hasn't really committed to ongoing testing. Why is that?
Well, we are testing across the country regularly, both at the border and in spot checks before milk is put on the market. So we make sure that lactating bovine animals are being tested. And it's exceptionally important that we make sure that our food supply and our milk is safe. I can say all the testing has come back negative. We're going to continue to monitor the situation very closely, but I have full confidence in the testing that's being done.
Can we get an update on the flavored vape ban? Where are we with that? Do we have a timeline? What's going on there?
Yeah, so we're moving forward not only on vaping, but on all nicotine replacement products, on a ban on flavors. There are powers that are extended to me in the Budget Implementation Act, which we have before Parliament right now, which is moving through Parliament, that will give me those powers as a matter of right. I think it's exceptionally important that we shut down the flavors that are attracting youth to these products. I'm deeply concerned, as I have been right from the onset of vaping, that these products are being used as a new vector to addict kids who aren't ever having exposure to nicotine.
And just bringing it back to the cancer screening guidelines, have you spoken to any of your provincial counterparts about how they should be reacting to these, since they are the actual frontline implementers of these recommendations?
Yeah, I've had conversations with many of my provincial and territorial counterparts, very much been in the spirit of cooperation and working together. I think we want to have a harmonized approach that's rooted in science and evidence.
Are they as frustrated as you are with these recommendations?
I don't want to speak for them directly. I can speak for myself. I would leave it to speak for them directly as to whether or not they're frustrated.
On when we might see the expansion of eligibility on dental care this coming month?
Yeah, well, you know what, one of the things for me, because next month, June, I've always said in June, we're going to expand to those who are 18 and under, and persons with disabilities who are eligible for a tax credit. But, we've been able to get it right so far. Providers are really having a positive experience. We've had no negative feedback on how the program is working. That flawless execution, to me, is essential in every step. So we're going to keep our June commitment, but at this point, I'm watching all of the details to make sure that when we roll it out, it's equally smooth for that cohort as we begin to move there. So I don't have a date yet, but it will be in the month of June.
What factors you're looking at?
Well, the factors I'm looking at are just general readiness, making sure in terms of how we're communicating and reaching out to those folks, making sure that we're continuing to test our systems, that we're 100%, I know that we're 100% ready for July 8th, but as Shakespeare said, make assurances double sure. So it's just we've had a really phenomenally positive rollout, and I want to make sure that that continues. So we're absolutely going to keep that June commitment, but I just want to make sure that we continue to have a really positive, smooth, flawless rollout, and that's why we're going to make sure we take a bit of time to meet the deadline that we set, but I'll be able to give more guidance in terms of exactly when in June very soon.
Back onto the flavored vapes, I'm sorry, but I can go to the LC right now and buy blueberry flavored vodka. I can go to the weed store, buy blueberry joints. How is that different from vapes?
Well, the reality is nicotine is a wickedly addictive substance. I think that the other piece that is exceptionally different is that the original intention of these products was to get people off of tobacco. So the reason, and look, I was the head of Heart and Strokes Ontario Mission at the time when vaping began taking off, and I said at the time that this isn't a cessation tool. I mean, it can be, but it also can be a new delivery mechanism for nicotine. Anytime you're putting a new product, something brand new out into the market, like alcohol has existed for a long time. Cannabis is a whole other conversation, and I'm willing to have it. But this was an entirely new vector. It didn't even exist as a product, and they were bringing it to market. And they claimed that it was for the purpose of cessation. And yet the marketing and the flavors addicted all kinds of kids. And now we have huge cohorts of kids who are addicted to nicotine to disastrous health effects because these products are being used in a way that they weren't intended to be used. And so, one of the reasons that I'm coming so aggressively at nicotine pouches is because it's the same darn story all over again, where they were approved for the purpose of cessation. And now at sports games, we see kids with these under their tongues as a product they'd never been exposed to before. These are kids who had no intersection with nicotine, now getting addicted to a deadly drug. It's disgusting. It's repugnant that these companies would do that. And so it's essential that we have the power to be able to act as rapidly as they act. And as soon as they find a loophole, we have to be able to close it. And we have to make sure that they don't have flavors that entice kids to get to this extremely addictive drug. Because once you're hooked on nicotine, it's incredibly difficult. You really have your reward system weaponized against you, and it becomes a devastatingly difficult thing to get off. And if you don't, it is disastrous for your health.
So what's the timeline for banning vape flavors then? I mean, you said, it needs to be passed in the Budget Act, but when are you actually going to do it? This was 3 years ago.
Yeah, sure. Well, I mean, as soon as I have the powers under the Budget Implementation Act, I want to act immediately. Okay, thanks so much, everybody.